This video is meant to demonstrate the typical cataract surgery. After a small incision is made, lidocaine is injected into the anterior chamber of the eye. This is followed by injection of a thick substance called viscoelastic that holds the shape of the eye. An incision is made in the cornea that is 2.4 millimeters wide. The cataract is contained within a capsule inside the eye. Therefore, we must tear a 5 millimeter hole in this capsule to access the cataract lens. To separate the cataract from the capsule, a fluid called balanced salt solution is injected around the lens. The cataract must spin freely within the bag to allow for easy removal of the lens. Ultrasound is then used to remove the nuclear portion of the lens, which is the hard center. At first, a central groove is made within the lens. The lens is then cracked into two pieces. A second groove is made in one of the pieces. This piece will then be cracked in half again. Once we have three completely separated pieces, the individual pieces are then removed individually. There are many different techniques for removing the nuclear portion of the lens, and this is just showing one particular option. Once this final segment is removed, all that remains is the cortex of the lens, which is the outer shell of the cataract. Using a vacuum, this cortex is stripped from the capsular bag. Once removed, all that remains is an empty capsular bag that will then house your intraocular lens. Viscoelastic is then injected into the capsular bag to hold the shape of the bag, allowing easy insertion of the lens through the injector. The lens is folded to fit through the 2.4 millimeter incision. The lens is then carefully positioned within the capsular bag as it slowly unfolds. The thick viscoelastic must then be removed from the inside of the eye. The eye is filled with the balanced salt solution. Fluid is injected into the cornea by the incisions to cause swelling, which will seal off the incisions. Therefore, no suturing is required. The wounds are checked to make sure there is no leaking. The lens is now centered within the bag.